Hello, my name is Saraf Narishad. I am the chair of the Senate Mental Health Advisory Committee, and I welcome you today to the committee's first webinar. As you can see, I'm well accompanied here. So without further delay and before continuing, I will take the opportunity to present the participants on your screen, starting with our special guest, Dr. Georgina Zahirneh, President of the Canadian Psychiatric Association. Thank you, Dr. Zahirneh, for having taken the time to be with us today, and we really appreciate your participation.
Thank you. I really am honored to be able to present today on obviously a subject that's very close to my heart in my work and personal life, talking about mental health and hopefully contributing to improving the mental health of our population. Thanks.
Thank you. We also have a couple of our members here with us. We have the Honorable Senator Kutcher. We have the Honorable Senator Marshall. Barb Laurie-Leroux, Deputy Chair of the Committee from Senator Stuart Olson's office. And finally, we have Jonathan Dion from the Human Resources Directorate. Thank you all for your presence and your participation as well. Now, with that said, for today's session, we propose a two-part program. In the first, Senator Kutcher will be doing a presentation on the fundamental concepts of mental health. And during this portion, you will not only have the opportunity to gain and bolster your knowledge on the correct terminology used to describe various core mental health concepts, but also on the human stress response. During the second part, the webinar will include a question period during which Senator Kutcher and Dr. Zahirneh will answer questions that were submitted to the committee by senators and by employees of the Senate, the House of Commons, and the Parliamentary Protective Service, which will be asked on behalf of the submitters by our members. Now, on that note, Senator Kutcher, the floor is yours.
Well, thank you very much, Sadif, and I'd like to acknowledge the really great work that the Senate Mental Health Advisory Committee is doing, and to acknowledge the presence of my colleague from the Chamber, Senator Marshall, and other members of the committee who are here today, and a special welcome and thanks to Dr. Georgina Zahirneh. I'm looking forward to her insights, as I no doubt I'm thinking you are as well. So the presentation here is understanding key concepts in mental health. And it makes good sense for us to start by asking the question, what is mental health? A relatively simple question, but a very complicated answer. And it may not be what you think it is. For decades, we've had quite a lot of discussion and awareness building about mental health, and that's really good. But unfortunately, one of the things that has come up during that time is a bit of confusion about what mental health actually is. In fact, sometimes people use the phrase mental health when they mean mental illness, and that causes no end of confusion and consternation, because how can you decrease stigma against mental health, for example? It's not mental health we're decreasing stigma about, it's mental illness we're decreasing stigma about. So it's really important to understand what is mental health. Very simply put, mental health is not about feeling good. It's actually the capacity to successfully adapt to the challenges and opportunities that life brings to all of us. So to reiterate, it's not about feeling good all the time. That's not what mental health is. Negative emotions are most often signs of good mental health. For example, if someone that you love dies, it's normal to feel intense sadness and grief. That's a normative response. If you have a problem in your life and it is upsetting to you, say you have an argument with a family member and you feel upset after that argument, that feeling of upset is normal. It's not a sign of bad mental health, it's actually a sign of good mental health. in our current context, a feeling of worry and being concerned about the pandemic is not a sign of a mental health problem. It's a sign of a rational response to an external threat. So what we can take from this understanding is that most of the time, these negative emotions are a signal that there is a challenge or an opportunity in your life, and that you need to pay attention to what that challenge or opportunity is. And that's provided to us through something that we call the stress response. When something happens in our environment, our bodies and our brains act in response to what is happening. And the signal that they use is what we call the stress response. And at one extreme, the stress response is fear. And at another extreme, it can be, I'm feeling perturbed. It's still the same neurobiological signal. It's just different depending on what the challenge or opportunity is. It's the first step to tell us that we have to acknowledge that there is something we need to deal with. And it is the first step to help us adapt to the realities of our lives. So when we get that signal, the first thing to do is to acknowledge, this is the signal that I'm getting. Not as this is a negative thing or a bad thing, because that's putting an attribution on the signal that may not be appropriate. But this saying, okay, I'm getting this signal. It's telling me that I've got something in my life that's a challenge or an opportunity, and I have to figure out how to deal with it. That's the first thing. The second part of that is that you answer the question, how do I deal with it? You problem solve it. And very often, how to deal with it means asking other people for help. So this stress response has built into it actually part of the solution for dealing with what's causing the difficulty. And that is getting the support and advice of others, reaching out to people. And then the final part of that is decreasing the intensity of that signal if necessary. Because you see, if you did step 1 and step 2, very often when you've solved the existential challenge or existential opportunity, the signal goes away, and that tells you, I've solved this. And you're left with the solution, and that becomes an arrow in your quiver for the next time that you face a similar problem in your life. So that's how we learn, that's how we adapt, and that's how we become resilient based on our mental health. So it's the process of developing that component. So we actually know from relatively good research that expecting to always feel good can impede your adaptive abilities. If you're always expecting to feel good and something negative happens in your life, and you interpret that negative as bad or bad mental health, and you don't embrace it and try to use it to help you solve the problems, help you take advantage of the opportunity, we know that thinking that way is not necessarily a good thing for us. So important to remember that mental health means the capacity to adapt to life, and that means struggling with the challenges that life gives us and dealing with the emotional states that life gives us, because life gives us a lot of these emotional states, negative and positive. So now we also have to differentiate this from mental illnesses. And mental illnesses, which we also call mental disorders, are syndromes. And what that means, they're a collection of signs, what other people see in somebody, and symptoms, what the person experiences within themselves. They are clearly different from the usual state of that person. These are accompanied by functional impairment, so inability to do well at work, at home, in interpersonal relationships, in your hobbies, all those different things. And they persist for specific lengths of time, sometimes for your lifetime, sometimes for months, sometimes less. These mental illnesses are codified in a number of diagnostic criteria which are used internationally. They're called the DSM-5 and the International Classification of Diseases. This is edition number 11, the ICD-11. And they are codified exactly the same way that all illnesses are codified: diabetes, arthritis, heart disease, multiple sclerosis, whatever. So that's how they are defined, and that's what mental illnesses mean. So mental illness is not the same as mental health, and people can have a mental illness and have really good mental health at the same time. So we really need to ensure that when we talk about mental health and mental illness, that we use the right language, because language really matters. And we're seeing now during this pandemic, even doubly how important it is to use the right language. For example, the word anxiety is increasingly being used to identify many different negative emotional states. This has the propensity to confuse normal emotions with mental disorders, because there are mental disorders which are called anxiety disorders. And when we use the term anxiety for normal human emotions, people get them confused. And actually, we have seen this confusion in many mental health surveys of the population, where they ask people, have you felt more anxious? And everyone says, no, yes, 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 yes. But they're not allowed or given any options than the word anxiety. So they're not asked, did you feel more scared? Did you feel more frightened? Did you feel more concerned, annoyed, perturbed, tense? They're just asked anxious. And so people who feel distressed or who feel worried will tick anxious, because that's the only word that they have. And that confusion just pervades our discussion around mental health. So it's really important that we really use the language properly. And I'm going to talk about what I call the 3Ds in just 1 minute. But before I do that, I want to also give you an example of another very overused word, which also often confuses people between a disorder and normal life experience, and that is the word depression. That word has now become a generic term to also mean any negative emotion which makes you feel down. And as I said, it's confusing because there are mental illnesses that bear the title depression, major depressive disorder being a big one. So instead of using the word depression all the time, let's try to use a word that is more clearly signifies what we actually are feeling, like sad, demoralized, or miserable, heartbroken, resentful, dismayed, disappointed. Those are all really nuanced examples of our feelings, and they're all confused when we use the word depression. Because if you're feeling discouraged, you're not depressed, you're discouraged. And how we respond to you on that basis and how you solve the problem of discouragement is very different than solving the problem of depression. So one of the things that is useful for people is what we call the 3Ds, as in describe, define, deliver. Describe. Use adjectives to describe how you are feeling. Define. Use the right word that defines how you are feeling. When you name it properly, you've got it. So if it's glum, use glum. If you're resentful, use resentful. If you feel downhearted, use downhearted. And then deliver. What is that feeling telling you, and how can you use that feeling to solve the problem or take advantage of the opportunity that it's identifying? Describe, define, deliver. Off you go. that will be a very, very useful way of thinking about your feelings and will give you control over them. It will help you be able to regulate your own emotions because you are now describing, defining, and using them for the purpose for which they were intended. Now, we are often asked, what are the kinds of things that we can do to obtain and maintain good mental health? And we've put together 5 plus 1 to thrive. And the reason it's 5 plus 1 to thrive is 6 doesn't rhyme with thrive, but 5 rhymes with thrive. So we do 5 to thrive plus 1. And here they are. And it's based on the concept of what's good for your bicep is also good for your brain. Your mental health resides in your brain. I mean, that's where all emotions come from. That's where your cognition comes from. That is where the definement of what you behave comes from. So a healthy brain and a healthy body, they're united, should not be separated. And what's good for you, period, is good for both the body and the brain. And you know, the body does carry the brain around. The brain is attached to the body. There are relationships between them. So let's not forget that. Well, the first is exercise. It is, if you could choose one thing that you can do for your health, whether that's your brain or body health, it's exercise. It's not too late to start now. It's about 150 minutes of vigorous, that means getting your heart rate right up to about 80%, vigorous weekly. So walking to your car doesn't count as exercise. All right? No, that doesn't count. Raising a glass of beer, not exercise. So you've got to actually put the time in. And you know, that's about 5 days a week, a half an hour a day. And you've got to structure that into your daytime. But you know, it's that same concept. You pay me now or you pay me later. And it doesn't matter how old we are, that exercise. For example, when you get to around my age, we know that exercise is probably the best thing that we can do to decrease normative cognitive decline as you age. And it probably has a protective impact on the development of Alzheimer's disease. So these are the kinds of things that we can do. And the younger you are that you start this, not only do you develop good heart health, you develop good brain health. So exercise. Then there's nutrition. And by nutrition, I mean follow the Canada Food Guide. You don't need any special diets. You don't need any special supplements. You may not want to hear this, but my medical colleagues call supplements expensive urine. You can take all the supplements you want. Your body just sends it out. And you want to be healthy, you want to eat healthy, the Canada Food Guide is a pretty good place to look. Eat less, move more, mostly fruits and vegetables, legumes, meat occasionally, fish is often used, you can get it, and that's not just because I live on the East Coast. Sleep, sufficient quantity and good quality of sleep. When you sleep, not only does your body get restored, but your brain gets restored. Really good sleep helps you remember what's important that you have learned from the day that passed and gets your brain ready to learn for the next day. And for young kids, if you have kids and you're listening to this, it's 9 to 10 hours of sleep. For people, when we get older, it really is 7 to 8 hours of sleep, and you need that. And so you got to really try to get that. In fact, there's a fascinating system in the brain that actually was only discovered about 5 or 6 years ago. That when you sleep, your brain cells actually shrink a little bit. No, don't worry, that's not bad. It's actually very good. And what it does is actually all the toxic waste that has been produced by cellular metabolism during the day gets pulled out of the brain and into the lymphatic system. It's called the glymphatic system. So gosh, sleep is so important for you. The next one, the fourth one, is strong and supportive relationships. Pretty well every single study of healthy longitudinal aging that I'm aware of shows that one of the most important factors for long-lasting health, physical and mental health, is having strong, supportive relationships. Family, friends, absolutely essential. So having someone to support you, but also you supporting someone else, both are essential. And that leads me to the fifth one, which is helping others. So part of being in a strong and supportive relationship or set of relationships is that you receive help from others and that you do help others. And in addition to that, taking on other tasks in your community, such as volunteering, is a great way to improve your mental health, giving back to others. And then the final one, and this is +1, is don't smoke or vape, period, end of story, forget it. Don't smoke or vape. No good comes of that. And use legal substances in moderation. A little bit of alcohol here and there. Now it's a little bit of cannabis here and there, but just a little bit and just here and there. Okay, so we're cool. Now, how do you differentiate these really good things, 5 to Thrive +1, and your mental health and these negative emotions from, whoa, when do I actually need to get help? Well, there's something we call red flags, little red flags that tell us that, okay, maybe what we're experiencing is something beyond just the normative range, and there's a huge normative range of emotions. So what are the things that we look for that are a signal? Say, okay, maybe if this is what I'm getting, or if this is happening to a person that I'm close to that I have to help them with. So the first thing is that very often it is the sort of normative emotional states that we can have. But, and this is an important but, they are incredibly intense and that they last for a long time. All right, so way more than normal, way more intense than normal, and persisting. In addition to that, because of those states, we have impairment in our functioning, in our relationships, in our ability to work, in our ability to be intimate with others. Maybe we start to turn to alcohol and drugs to help us manage those emotions. Those are red flags. The other thing is that new things that we don't usually have start to surface, and many of these new things are physical: fatigue, sleep problems, nausea, disinterest in life, all sorts of aches and pains. Important one is loss of pleasure or suicidal thoughts. So if those things are happening to you or to a family member or to someone that you care about, that's a sign that additional help may be needed. And it's a sign of strength to ask for help. Courage is the first step. And asking for help when you need it, when those signs are occurring, is really what you do. So hopefully that helps you understand a bit about normative emotional states and differentiating them from states that are still emotional but require potentially professional help. The next slide that you're going to be looking at is a graph that I designed way back at the beginning of the pandemic when we started doing work with different agencies. And we talked about, if you look at that graph, we're in the box right now. And if you're facing the screen, it's at your right-hand side where we are in the box. So what we had happening is we had cases occurring in Canada. We had the curve then flattening. And now we are starting to see the curve go down. But we're also seeing some of the problems. And if you look at the dotted line, it says the curve is flat. I will ignore physical distancing and do what I want. Well, we've seen that start in some places, and bang, up come the cases again. So we're in what I call the deep slog part of this pandemic. It's been going on. We're all tired of it. People are using the phrase pandemic fatigue. When we put this graph together 3 months ago, we used the word deep slog. I like slog better than fatigue because fatigue figures a physical reaction, while slog is a sort of a mental and physical one together. So we're in this deep slog phase. And what we need to do is, as the cases go down, is to realize that we are in this kind of phase. We are now experiencing lifting of physical distancing, which is great. But with more freedom comes more responsibility. So the responsibility of washing your hands, of physical distancing in public spaces, of now that the data is in, wearing a face mask indoors. So those are the kinds of things and constantly washing your hands over and over. Don't just because you wear a face mask, don't stop washing your hands. So those are the kinds of things that we need to do. Our spirits will lift as we do that. But remember, we will need to continue some of these things as we go ahead. So now, on the next slide, we're going to talk a little bit about working at home. And I just want to acknowledge that we've been resetting how we work, and I'll talk a bit more about that in a minute. But in terms of working at home, here's some advice from the Mental Health Commission of Canada. Number one, feeling disconnected or uncertain is normal. That's a normal response, just like we talked about. It's a signal that you have a problem that you need to solve. So how do you solve that feeling of being disconnected or uncertain? How do you reach out to your supervisors? How do you reach out to your colleagues? You have to figure that out. It says multitasking is not suggested. Well, I don't know who wrote this, but the reality is that you cannot multitask. It's not possible. The brain is a parallel processor. It has to shut off what it's doing to switch to something else. That's how our brains actually work. So I don't know where this idea of multitasking came from, because it is neurophysiologically impossible. You think about it for a sec. If you have something that you have to focus on, so you're driving your car and you're in a high-speed freeway and there are all these signs coming up, and you've got the radio on, you automatically shut the radio off. Why? Because you need to focus on something, because your brain isn't a multitasker. So remember, you're a parallel processor, not a multitasker. And the more stuff you got coming at you, the more your brain has to switch from one thing to another thing, and switch to another thing and another thing. You're switching back and forth, and you end up not being able to keep your focus on anything. I do that naturally because I have a condition called ADHD, and we're wonderful at switching, but we're not so good at focusing. Set boundaries. So that includes time away from electronics like you're on now. Okay, so pause, go, have a coffee, come back. No, I'm just teasing, but just gotta set the boundaries about it and maintain periods of time that are for you or for your family. And in order to do that, you have to set a routine and follow a routine. And I'll tell you, I know, and you know how difficult it is to follow a routine. So when you screw it up, and you will, because I do all the time, you just say, okay, I screwed it up, go back, try it again. That's the key about routines. You don't beat yourself up because you didn't follow it, because the reality is, I don't know anybody that follows a routine perfectly. The next slide is advice from Dr. Christine Chambers, who happens to be a friend as well as a colleague. She's a wonderful researcher in pain research. She's also very, very involved in Canadian Institutes of Health Research. And she points them out, and this is particularly important for people who have families. Very often, mothers, others, fathers, when they have families, join the Zoom meetings when you can, because sometimes the family realities just get in the way. And so that's the way it works. Camera is optional. All right, good. Don't have to primp to go on a Zoom meeting. Eat your lunch. If you're hungry, if that's what you're doing, eat your lunch on Zoom meetings. I know with my colleagues in the Senate, I don't know how Senator Marco finds it, but oftentimes when we do Zoom meetings, people are eating away or talking things, their phones are going off, just like it wasn't normal in our committees and discussions. That's okay, you know, good. If you have children, keep your door open to monitor the kids. You don't know what kind of chaos they're getting into if you're not monitoring them. It's okay if their voices and noise comes in. You know, a number of our senators have children, and when they're on the Zoom calls, the kids come in, they sit on their lap, we say hi to the kids, and then off they go. That's good, that's important. That's how it's done. That's family. Do what you need to do. If you need to get up and leave, go do that. And move around. I'm going to tell you a secret here. I don't want you to tell anybody else. But in a lot of our Zoom meetings, particularly when we're in our groups and we're talking about things and people are talking and talking and talking, I shut my video off and I go and do push-ups. And then I get up and come back to the meeting. So I'm bringing in my work at exercise. And you know, don't tell everybody, okay? All right. So now the next slide talks about resetting the workplace. And this is what we're actually going to be doing. People talk about returning to work. We're actually not, I hope we're not returning to what we had before, because what we had before got us here. We don't want to be in that same situation. We want to reset the workplace. Now, historically, work and home, but we're integrated. In agrarian societies, where you worked and where you live, they're together. On a farm, when you work and live in the same area. With the Industrial Revolution, the workplace got separated from the home, and people had to travel back and forth to the workplace. With the technological revolution, we now can move to a hybrid model, where some of the work can be done electronically in your place of residence, and some can be done in the place of work. So we have to make sure that we don't confuse working with the workplace. And I think we're now moving into a revolutionary phase in our society of asking, what does the workplace actually mean? And how does the nature of work relate to where we live, where we play, and where we go physically to do something that we call work? And this is going to take a bit of sorting out, and different types of work will be more traditional, less traditional, different in some way, but we can expect that we will figure this out, we will sort this out over the next 5 to 10 years. And it's so important for employees and managers and supervisors to have these conversations about what constitutes the new workplace, and how does the nature of work change because of this pandemic and because of our capabilities to make a change. So there, and different people will have different needs, and so we'll need innovative solutions to these things. Remember that employees will have health realities. There'll be some people who may have chronic illnesses, so they'll want to decrease their risk of being close to other people. There may be some people who have an elderly or infirm family member or are themselves immunocompromised. Again, they'll want to decrease the risk of going to a workplace because of the COVID. So those will have to be taken into consideration in any way that we reset. And also, it's important for employers to understand that post-pandemic, we will, and we are now starting to see a surge in healthcare. So people who have been waiting for a colonoscopy, for example, and they've been bleeding and losing weight, they really need a colonoscopy badly, and that's been put on hold. Now that surge, that pent-up demand, going to the dentist. I just came back from the dentist, was not a pleasant experience. I got to go back on Monday. You know, that's a pent-up surge. We're going to that. And there are other issues around going back to the same place. How does transit work? What are the rules on transit? And what's the prevalence of COVID in your community? So if your prevalence is low, in Nova Scotia, we haven't had a case in 14 days. That's different than in the city of Ottawa. or the City of Toronto. So if the prevalence is low, you have much more comfort that your return to a place may be easier than if the prevalence isn't low. So all those things are important. There are no simple answers, but one thing that we know is that everybody needs to be involved in the redesign and the reset of how we go to a place to work and how we work, period. So the last slide that I want to talk about, and this is the last of my talking at you, is called treatment and self-care. And self-care, as I talked about before, describe, define, and deliver, that's the basis of self-care. We can do that. We understand the stress response. We know what it's there for. We figure out how to problem solve. We get help from others. We're good. We're good to go. Self-care is not self-indulgence. People confuse the two. Self-indulgence is not self-care. Self-indulgence, if you want to indulge yourself, go for it, but it's not self-care. You don't need to buy all the stuff on Gwyneth Paltrow's website to be taking good care of yourself. It's not the same thing. You don't need diamonds on the soles of your shoes. You don't need all those amazingly expensive jade eggs, essential oils, all those interesting things. Those are not self-care. So don't confuse the two. The other thing that's really important to remember is that treatment is not needed for normal negative experiences. The reason they're called normal negative experiences because they're normal and they're negative and you're experiencing them. You don't need treatment for that. You don't need to go see your psychiatrist. You don't need to go see a psychologist. You don't need to go see a therapist. You just need to be with your family and friends. Now, it's also important to understand that when we do talk about treatment, we're talking about something more than just that. We're talking about something more than just support of others. And we talk about treatment in three different categories: standardized, complementary, and alternative. And standardized treatment means that the treatment has met defined scientifically based criteria for effectiveness and safety and utility, how it's delivered. And that's done for example, prescription medicine. There's a regulator, Health Canada, that says that. For psychological therapies, it's the Canadian Psychiatric Association, it's the Canadian Psychological Association that looks at all the research that's been done and say, yeah, based on all this research and the best evidence that we can find, cognitive behavior therapy is a good intervention. Interpersonal therapy is a good, solid intervention. So that's how that stuff is done. And that's what we call standardized treatments. And that's what you'll get when you go to a duly qualified mental health provider who practices these treatments. And they train for a long time to be able to deliver them effectively and efficiently and safely. But there are complementary treatments, and those are things that can complement the standard treatment. They can maybe make it work better. They can give you additional health benefits than just the standard treatment. So a classic one of these is exercise. Exercise gives you much other additional benefits for your health. Plus, there's some evidence that can improve standard treatments for a number of different disorders. And then there are what we call alternative treatments. They're not the same thing as complementary. They are not used together with, they're used instead of the standard treatment. And what alternative means is that we don't know if they work. We don't know if they're safe. And we don't even know if it's a preparation that you're taking, if the preparation meets criteria for purity. And there are interesting studies, for example, of akinesia, which is marketed as a cold preparation, done which show that if you look at what's actually in the tablets, many of the preparations actually have no akinesia in them, but it says on the bottle akinesia. So you have to be really, really careful. It's buyer beware for alternative treatments. Before you pay, and if you want to take an alternative treatment, that's your business. But before you pay, do the research or ask your doctor or nurse practitioner about their understanding and the evidence behind what you've chosen to do. All right. If you have questions for the committee, you can contact us at the URL that you see below. We will do our very, very best to answer all your questions. And I know that CEDIF also has a huge list of resources that hope you will find useful and helpful. Please go ahead and go on all those resources. As we move along to returning to our workplaces and as we move to understand our work reset, go for it. Stay safe, stay calm, and enjoy your life.
Thank you, Senator Kutcher, for the presentation. It was very interesting. And now we'll move on to the second portion of the webinar, which is the question period. And we will begin with Senator Marshall. The floor is yours to ask the question.
Yes, thank you very much, Sadaf, and thank you for an excellent presentation. It was informative and helpful. I've learned quite a lot here today. I have a question on the virtual workplace or working from home, which you spoke about. I mean, during the pandemic, now there's been numerous reports in the media talking about an increase in intimate partner violence, phone calls to the Children's Helpline, as well as other social issues. For example, the stats indicate that intimate partner violence has increased, but the reporting has actually decreased, and the number of phone calls to the Kids Help Phone has increased. Are there any statistics or information indicating what is happening in our virtual workplaces? Because regardless of whether employees continue to work in their same physical workplaces or whether they're working from home virtually, there continues to be interaction between colleagues, subordinates, supervisors, and bosses. So many people are feeling the extreme stress now of working on a very different, demanding, and different circumstances. So my question is this: workplace harassment can significantly affect mental health, as we know. Are there any statistics or other information which would indicate whether workplace harassment has increased during the pandemic? And if not, is this an issue that we should track? Because working at home is probably going to be a fixer or a fixation in our future. So could you comment on that?
Well, thank you, Senator Marshall, for that really prescient question. There's so many components to it. I'll try to hit them as best I can. First of all, on the workplace harassment, I think you're absolutely correct, is that workplace harassment can have a major negative impact on people's mental health, not just on the individual experience of harassment, but on the whole place itself. Now, to my knowledge, there are no solid statistics on workplace harassment in this different medium. I have heard anecdotal evidence of challenges between employee and manager, often around when they're accessible or available to respond to urgent needs or perceived urgent needs, or whether they're expected to be, in front of their screen from 8 o'clock to 4:30 solid. Doesn't matter if the kid's having a heart attack. So I've heard about those kinds of things. I've also heard about managers who are micromanaging electronically now, and that's a challenge. But I don't know if that is the same thing as workplace harassment. It certainly it could be a conflict in the workplace, because not every conflict in the workplace is harassment. So I don't know how that is playing out. I just don't know. I think your concerns about intimate partner violence are right on. Intimate partner violence is a significant concern, not just now, but pre-pandemic as well. And maybe Dr. Zahirni will know better, but my understanding is up to 20% in the work of women in the workplace may experience intimate partner violence. And this is not something that is usually addressed by mental health programs for the workplace. And frankly, if we really want to improve mental health of employees in the workplace, if we're not addressing intimate partner violence, we're missing the boat. You know, telling someone to take some deep breaths when they're feeling upset, that doesn't address intimate partner violence. Having them scribble in a coloring book, that's not going to address intimate partner violence. We really need to get at the root of this problem. And this is one of those long-standing negative social problems that we have sort of, paid a little bit of attention to, but sort of not really dealt with. And it's really high time we start to deal with it. Absolutely. The issue you talked about with Kids Help Phone, absolutely. When the pandemic started, there was a huge upsurge in calls to Kids Help Phone. I haven't seen the data for the last few weeks, so I don't know if that upsurge has maintained itself or has leveled off. Many of the calls actually to Kids Help Phone were not what people expected. So there were no increases in calls for suicide. In fact, if anything, I think they went down. There were calls about all sorts of mental health concerns. One of the most common ones was body image and eating disorders and issues around friendships and family relationships. And many of these would have been dealt with in schools before the pandemic. So the Kids Help Phone is a wonderful resource for kids at any time. But during the pandemic, it was sort of stepping in and being another resource that now the kids couldn't access their supportive relationships with teachers and counselors. They were then able to pivot over to Kids Help Phone. And so the work they've been doing has been outstanding on that regard. I think that for all employers, supervisors, people in the workplace, doesn't matter, we really need to help foster a good understanding of what a healthy workplace is. Physically healthy and mentally healthy workplace, and to ensure that workplaces move towards those directions. I know that the committee has been starting to look at some information around what constitutes a mentally healthy workplace. I'm hopeful that the committee will get their teeth into this in the upcoming months, and then make that information available to the Senate employees. But yeah, I completely agree with you. We really have to get a much better handle on how to make sure that our workplaces meet not just physical health standards, but mental health expectations.
Oh, well, thank you for your comments. I guess just briefly, we do agree that there is a concern about intimate partner violence rates going up. It was raised by the United Nations, and certainly some of those risk factors for intimate partner violence are going up during the period of isolation, including the long confinement, financial uncertainty, increased substance use disorders or use during confinement. So we are very concerned about it. And I think there's also, it is very important, and even as employers and as colleagues, to also be aware of some potential signs and of resources if we are concerned that somebody could be a victim of IPV, as we call it, interpartner violence. So we don't have those good data of rates going on right now, but we certainly have a great concern that it is a risk factor in this kind of pandemic situation. And certainly as we see that if as the restrictions socially go on, as economic instability may be impacting more people, then we really need to keep an eye out for this and hopefully prevent, and be aware that those resources are open. Shelters remain open. There are also campaigns in terms of using safe words for employers from via Zoom, or for having even what we call developing a safety plan for people who have been previous victims of violence, so they know what to do in a crisis and reaching out. So it's very important to people to know that prevention is really key as well.
Great. So Barb, if you would like to ask the next question.
Thank you. Just wondering if you can share some of the up-to-date evidence-based information related to suicide, especially in the context of the pandemic. And also, has there been an increase in cases of suicide since isolation measures were put into place to control the spread of COVID-19?
So it's Dr. Zerhany, I'll answer that. Thank you for the question. Certainly, we don't have a lot of good data in terms of what are the outcomes and the impacts on the mental health, specifically of such large-scale disasters, particularly one like this, the pandemic in modern times. But one of the concerns is that suicide might rise. It's not inevitable, but it is a risk that suicide rates could rise. And again, you know, what we want to do is take that preventive approach in terms of looking at those people who are more vulnerable and potentially at higher risk. We don't have data yet on what would be actually, is there an actual concrete increase in suicide rates? But as I said, there are certainly a concern that it is a risk. And so what are some of those things that could increase the potential risk? You know, we talked about the isolation. There are some studies saying even the stigma of COVID-19 itself, that some people have had suicidal thoughts. As I said, I'm aware of cases, but they've been picked up preventively. We also concerned about worsening of pre-existing mental illness, so people who are already struggling with mental illness and the pandemic presenting additional challenges. So access to good care is very important. And also our recent discussion on IPV, intimate partner violence, is actually a risk factor as well for suicidal thoughts, and substance use disorders, which we do know are on the rise, and are a risk factor for people impulsively or accidentally, not accidentally, but it is a risk factor that can contribute to being more at risk of acting on suicidal thoughts and access to lethal means if they're available. So we do have concern about risk. We don't have good data, but we also know that there are ways that we can intervene to minimize those risks and protect the population.
Senator Kutcher, did you have anything to add?
Yeah, I completely agree. I completely agree with Dr. Zahirny. I just want to share some of because my group is studying this, and what we have been impressed by is a lot of opinion and not a lot of data. And for example, one of Canada's leading suicidologists, Dr. Taylor Black in British Columbia, has talked about actual rates potentially dropping because of these protective self-isolation components that people are in, and less access to lethal means. And Dr. Zahirny pointed out, I think really precisely, that there are populations which are more vulnerable than other populations. And one of the largest group there is people who have an existing mental illness. So the prevalence of suicide in Canada is about 11 per 100,000. The prevalence of suicide lifetime for someone who has schizophrenia is about 10 to 12%, and 12% out of 100. So we have to ensure that those people who have a mental illness are adequately and appropriately supported during this pandemic time. And I know Dr. Zahirny has actually been in the forefront of using electronic methods of helping to reach people, and outreach, mental health outreach for individuals who are at highest risk. So I think that because of the work that Dr. Zahirny and others across the country are doing in these assertive outreach programs and moving to electronic ways of healthcare delivery, I think that that's also going to be very helpful.
Great, thank you for that. So the next question will be asked by Jonathan.
Thank you very much. So there was a question submitted to the committee regarding alternative intervention methods used to treat mental health issues. For example, using auriculotherapy for the treatment of depression and/or anxiety. Could you share your thoughts on the use of these types of alternative methods, especially for individuals that may have trouble with using medication to treat conditions?
Certainly, and certainly, Jonathan, and that's a very important question, and one that comes up frequently. And I'm sure Dr. Zahirny in her practice will have that addressed many times. I just want to answer that question by helping people understand how we make decisions about what treatment actually is. I touched a little bit about that in the slide, but treatment is based on two pillars. One is the basic scientific knowledge of chemistry and physics. All right, how this world works as it is played out in human physiology. How the brain works, how the body works, you know, that is basic hard science stuff. And we have improved our knowledge about that dramatically over the last 20 years, or over the last 150 years, unbelievably. Now, there still remain pre-scientific opinions about how the body works, but it's not, those pre-scientific opinions are not valid, okay? So we say, okay, yeah, that's a pre-scientific opinion, but that's a pre-scientific opinion. The best available science that we have shows that, well, you know, actually, the higher the dose of something, the more toxic it is, not the less amount of the dose is, the more effective it is. It just doesn't work that way. So that's the first thing, the basis in scientific knowledge. The second thing is robust, vigorous scientific research into effectiveness, efficacy, safety, and utility of any kind of treatment, regardless of the type. So not only do we analyze the type, we analyze the amount of treatment that's given. We call that in pharmacology the dose, in psychotherapy, number of sessions. We monitor the duration. How long do you have to have this treatment for it to become effective, if it's going to become effective? It may be that you need to take the treatment for 2 weeks, 4 weeks, 6 weeks before it becomes effective. That doesn't mean it's not effective if you're not better at 2 weeks, but because it takes 6 weeks to become effective. And then we also have to know how long do we actually need to take it, and what happens after we stop taking it. Do we relapse? Do we have a rebound and something? So all of these things go into deciding whether a treatment is what we call standard or not a standard treatment. And auriculotherapy does not meet the test for either of those two criteria. So that being said, as long as a person who's using that doesn't have direct or indirect harm, and what I mean by indirect harm is doing that instead of seeking care for a different treatment that is effective and we know is effective. For the treatment of depression, medicines are effective for some people. Psychotherapies are effective for some people. Some medicines are effective for some, and other medicines are not effective. Some psychotherapy is effective, others not effective. So my suggestion would be to look into those therapies that we know are effective. And if you want to do something else, as long as you're not hurting yourself, I mean, it's your money, you can do whatever else you want to do. I don't know what Dr. Zahirni would say about that.
Thanks. No, I absolutely agree. I actually had to look it up, auriculotherapy. Yeah, I agree that, you know, really, as we're trained medical professionals and we follow sets of guidelines, and there can be exceptions, and personalized medicine, obviously we want to take into account the personal choice, but really when we recommend a treatment, it needs to really follow a hierarchy of what we know works and what can work in combination as well. And personalize that to the individual, but they do have to be an evidence base for the recommended treatments. And I agree, there are many other things that make people feel good, that may be, you know, something that they enjoy doing, and I would put that more under self-care, but it doesn't come under an actual treatment for a mental illness. And I think and obviously there are some actual treatments, not treatments, but things that people take but buy off the pharmacy that you really should always verify with your physician if you're on other medications or have an underlying condition, be it physical or a mental disorder, that your doctor is aware of it, because we need to know what else you're doing and what else you're taking when we're designing a treatment plan for you. Thanks.
Thank you. I will be asking the next question. So numerous questions were submitted to the committee regarding the various challenges that individuals face with our new working arrangements, such as the lack of social interaction, the lack of separation between our home and work lives. On the other hand, there are some individuals that fear returning to work because of their concerns about the higher chances of being exposed to the virus. Could you share your thoughts on this issue and recommendations on how we can better adapt to this new reality?
Hi. So, yeah, it is a very new reality of work. So there are some benefits and some difficulties with working from home. But certainly, you know, we have to remember that it's very important to have structure. It is very important to have limits. So we need to have our day organized similarly and divided up in chunks that are workable, not multitasking again, but, you know, really focusing on the priorities throughout the day. But obviously, if you are working from home, then we do have to respect that it may be interspersed with other duties, be it childcare or, you know, caring for other family members. So, you know, again, we have to remember it's not just a free-for-all sitting in front of the computer all day, but structure your time, organize it, and also to keep contact, because it can be very isolating sometimes working from home. There's also a danger for somebody who is single and and you know, working from home, that social bond through work and that contact can also be an important support. So we do encourage people to reach out to their colleagues and have peer support and ongoing discussions about how, you know, workload and how they're managing with working from home. And as well, to not get into the trap of, you know, you're at home 12 hours a day and you're spreading, you know, your work. It kind of, there is too fluid. There's not that boundary and that cutoff of saying, okay, now it's time for family, it's time for myself. Even if you're alone, you need that time to recharge and to take care of yourself. And I do understand that, you know, as we deconfine, there are some worries about health, worries about, you know, exposure. But we also know that we have very good public health guidance. Each jurisdiction is giving very good guidance, and you know, we have rules that we can follow. And, you know, as I emphasize with my patients is that, you know, we have, these things have to be incorporated in our daily routine now. You know, that's kind of the new way of doing things, is washing your hands frequently, you know, remembering to wear a mask in public. It may be mandated in certain jurisdictions, but it's certainly strongly recommended if it's not even mandated yet. I'm in Quebec, and certainly it's already being obligatory in public institutions or in closed spaces. And as I said, it's a way of respecting ourselves or respecting our employees. So I think there is going to have to be a discussion between employees and employers about how we're going to also physically redesign the workspace to ensure that there's adequate distancing and that we can respect the public health guidelines of the jurisdiction. And I think that, you know, is that discussion about how you know, how do we overcome or live with the certain restrictions. I mean, I've been seeing patients in person when it's necessary, and, you know, we protect ourselves and we make sure that there's the distance and the cleaning. And so there are ways to safely return to work and to normal, knowing that there's a risk, but that we can mitigate those risks, adopting good practices. And then there's also these good social practices of having peer support and not allowing ourselves to get isolated in the workplace.
Thank you. Senator Kutcher, did you have anything to add?
Oh, I think Dr. Zahirni hit the nail on the head so many times. I just wanted to share a little anecdote here. It's getting used to going back to a different reality, and you have to be creative about it. So we have a number of grandkids who live close by, so we're actually able to help our daughter and her husband out a lot, since we're now allowed in the bubble in Nova Scotia to do that. And and it's enjoyable most of the time. And it's really helpful to her and to him. But we're trying to get the grandkids ready for the masks because they become obligatory in this province tomorrow. And so, you know, I don't like it. I can't breathe. So we go through and we talk about it all developmentally. And we're working at it, and we're gonna get nowhere. And then our daughter brings home these masks with the, you know, Toronto Raptors on it and the Pittsburgh Penguins on it. Oh, I want that one. I want that one. I'm gonna wear. Perfect. Innovation, developmentally appropriate. Go for it. Look at the opportunities here.
Thank you very much for that. Senator Marshall, the next question is yours.
Thank you very much. The pandemic and teleworking arrangements in effect have had important impacts on families. For example, some parents are concerned that they may be allowing their children to watch more television, play more video games than usual so they can concentrate on their work, and fear that this will have a negative impact on their children in the long term. Some parents also feel that it is challenging to properly educate their children about the virus, the importance of physical distancing and hand washing. Certain individuals also feel that they are not able to support their family members as they did before because of measures in place or because they are feeling overwhelmed about the pandemic. Can you share your thoughts on this? What are your recommendations for families to better manage these types of challenges with their children?
Thank you, Senator Marshall. First of all, I just want to put parents' minds at ease. It is unlikely that a small uptick in playing video games is going to have profound, long-lasting negative impacts on the kids' lives. So let's just take that off the table now. This is such a complex, important question, but it's so complex. There's so many different components to this. Is it one parent or two parents? Is it a nuclear family? Is it a blended family? Are there presence of support of other family members, aunts and uncles close by, grandparents close by? What's the geographic character of the family unit? Do they live in a small apartment in a high rise? Do they live in a house? Do they live on a farm? What's the age of the children? What's the distribution of those ages? What's the relationships amongst the siblings? Can the older ones be caretakers of the younger ones? What are the characteristics of each child? Does the child have a disability? Does the child have a mental illness? What are the different temperaments of each child? So right away you realize how complex this is, and there is no manual for parenting. It's not like a recipe. You do the best you can, and sometimes you screw it up, and sometimes you don't, and you just keep doing it. The most important thing is that you love your children and that you're there for them. That's the most important thing. Now, the other thing is that we can do on top of that is we try to establish a routine. We try to hold to it as much as possible. We want to encourage physical activity, encourage outdoor play as much as possible, again, to facilitate those things. We educate about the virus to the developmental level of the child. But first, you have to educate yourself as a parent, because if you don't take the time to make sure that you get the right information, not the YouTube misinformation or disinformation, but the real good information that comes from the public health agency or from your physician, and you got to teach the kids that for every problem there can be a solution. And yes, there is a virus, but these are the things that we need to do to counter it. And if we do those things, things will work out okay. And that's so important. You have to teach them, but you have to give them emotional reassurance that it's going to turn out fine if they work at these things. And you know, kids will understand, will respond to life and its challenges, particularly if they have a parent that is there to help guide them. And one little tip that I find very useful for parents, and not just during this time, but to try to establish as a routine once or twice or even 3 times a week where they have a special talking time with each child. And it becomes an intimate time with the parent. Children look forward to it, and you can talk about anything that you want to talk about during that time and open it up for them. Often it's at bedtime when the kids are younger. When they're older, the teenagers will choose the time that they want to talk. And that is so important for parents to understand that when the kids are little, they'll talk when you want them to talk. But when they're older, you have to talk when they want to talk. It's a huge switch. But having a talking time with your kids is so simple. It's so important.
Thank you, Senator Kutcher. Dr. Zahirna, did you have anything to add? All right. So with that, we'll move on to the next question that will be asked by Barb.
Thank you. My question here is, some employees have shared that they are living with a lot of frustration because of their colleagues who have children only work a part of the day. Due to this situation, they are expected to complete their colleagues' projects. They have shared that they understand that this is not the fault of their colleagues. However, they find that it causes unfairness. The question asked is, how can they deal with their frustrations and change their outlook?
Dr. Zahirne?
Yes, thank you. Another one of those challenges of working in a new environment. Yeah, so I think there are the two parts. There's the one part, which is what we can control ourselves, right? In this area of increased potential distress and change and unpredictability, we can only control what is within our own sphere. And one of the things that we can learn to control, as Dr. Kutcher's talk, as the Senator Kutcher's talk outlined, is our response to those negative emotions and stressful situations. So I think it is important to monitor our own responses and to deal with them, to show compassion and kindness and flexibility about what other colleagues may be going through. And sometimes there's the idea that they're off at home and maybe they have it better and I'm in the office. But and I think so we have to monitor our own reactions and work on those and those negative reactions. And then if there are perceived inequities, then those are things that we can bring to our managers. And our human resources if necessary, but really the emphasis is on clear communication of expectations. How are people working? How do we know that people are getting work done, or what are what is somebody doing at home? As I said, you can have the perception that they're not working as hard. They might have the perception they're working harder because their day is going longer because of other responsibilities. So as I said, I think from a manager perspective of having very clear communication, expectations, maybe meeting more frequently than would normally in a larger office, just to update and make sure everybody's on the same page about how we're distributing tasks. And it's also important that, for all workers, that they have adequate rest periods during the daytime, and as well, adequate tools to do their work. Whether it be from the office or from home. And I think those sort of protections can help decrease some of the workplace tensions, which will happen whether you're in the office or you're working from home. It's really about good communication and good leadership. And as I said, if there are other issues, then that's really for human resources and other official channels to step in.
Senator Kutcher, did you have anything to add?
No, I think that Dr. Zahirne just hit it out of the park.
Great. So the next question will be asked by Jonathan.
Thank you. So this question is about the current physical distancing measures that are in place, causing people to stay at home more often than before. Obviously, some of these individuals may face difficult challenges, such as a toxic home environment. This may impact their mental health as well. So we were curious to know what your advice for people that are now spending more time in unfavorable home environments would be, and what tools they can use.
Thank you very much for that question, Jonathan. It's really important. However, I just want to start off by saying that in most cases now, we're starting to see a relaxation of the physical distancing. So that gives a little bit more of a safety valve to people than when that question was first posed. And that's all to the good. So that's great. I want to put it into that context. The second part is, it's true that the people that are most impacted are those at risk of intimate partner violence, those in poverty with food insecurity, who are marginalized, who don't have access to good mental health care. That group we've always known has been the most important for us to reach, but we've not done a good job in reaching them. And we have alternatives put in place. So, for example, electronic mental health care has been now made available by most places, and it seems to be working fairly well. People can reach out, and it's important to reach out As Dr. Zahirni said, the shelters that are available are open. The emergency room is open. I had to go to the emergency room a couple of nights ago, and it was amazing. I've never spent such little time in the emergency room. There was nobody there. So they were pleased to see me. It's never happened before. Oh, pleased to see you. Come on in. We have nothing to do. The emergency rooms are open. The mental health crisis lines are open. And many urban areas, I don't know about so many rural areas, but many urban areas have mental health crisis teams. And the phone call to a mental health crisis team will often bring the team to you instead of you having to go to.
Thank you. Dr. Zahirni, did you have anything to add?
Just one quick comment. I'm not sure if I can't remember if I talked about it the last time, but it's also important to develop what we call kind of a safety plan or safety initiatives. I often do that with my patients who are at risk. So just, you know, that the person in a situation that is at risk of violence knows what to do when. So to identify what are the signs that things are escalating, and kind of, I always say it's like, you know, the fire alarm drills. That's what a safety plan is. It's like you're drilled, you know, when I see this, okay, can I get out to a safe spot? Who do I call? Do I have somebody that I can reach out to? Or when do I have to use those other more professional resources like actual helplines or shelters? It's important to be prepared in advance.
Absolutely.
Thank you for that. And the last question, I will be posing it. So the following question was submitted to the committee. Looking back at the Spanish flu epidemic as we deal with the current virus, do you think that the mental health disorders will be similar, or will it have its own set of mental health challenges? Dr. Zahirni, if you can answer that question.
Sure, thank you. Well, it's a slightly different context. I think that as a society, we have evolved towards a better understanding of mental illness, better treatments, and really better openness about talking about mental health. And I think the whole point of this talk, right, of distinguishing what is just mental distress versus what is mental disorders. So in the pandemic, was in an era where, you know, mental health was taboo. Mental illness was taboo. People did not talk about these issues. And as I said earlier, so far we don't have data that there is a huge increase in suicides. We have concerns that it could be a risk factor, but though we can now intervene on some of those risk factors in terms of reaching out and helping and supporting the people who are at risk. So I think it is a bit different from the times in the past. In the Spanish influenza, there had been some reports of potential increased suicide risk, but as I said, we are kind of in a very different era in terms of our understanding and openness about mental illness and mental distress.
Thank you. Senator Kutcher, did you want to add anything to that?
Thank you very much. I would agree with Dr. Zahirni. The only thing that I would add is that there's a lot about this virus that we don't know. Right now, there is an ongoing international study, actually Western University, Sunnybrook Health Sciences Center in Toronto, also are leading this work, looking at the impact of virus on brain functioning. And when you do that, then you talk about cognition, emotions, and all sorts of other kinds of things. There is some early evidence that for some people, the virus can affect how brain functions, and people don't really understand what that is and whether it will be there in the long term or not. So the answer to that part of the question, we will just have to say is a question. We don't know at this point in time. But the robust research environment that we have now didn't exist in 1918. And the robust, they're inadequate, but they're robust compared to 1918 services that are available for people. So I think we'll learn a lot more, but I don't think we're going to have a huge impact of other problems that we don't.
Perfect. Thank you very much. That concludes our question period and the webinar. Thanks to all the participants that are on this call today and for those that are watching. We hope that you found that this webinar to be productive and stimulating and that you leave more informed. We invite you to contact us with your questions and your feedback by using the email that you will see at the end of this webinar. And it will be our pleasure to receive them and respond as soon as possible. I wish you all an excellent day and thank you again. Bye, everyone.
Thank you. Bye-bye now.
Thank you.
Thanks, everyone.
Bye.